Welcome back to Champions of Care, brought to you by Oakwood Healthcare. Today we're talking about diabetes, and in this segment we're going to focus on diabetes' effect on the extremities, particularly the feet. I'd like to introduce you to Dr. Debbie Woody. Hi, doctor.
Hi, nice to meet you.
Nice to meet you. You're a podiatrist. You have offices in Taylor, and you also practice at the Wound Care Center at Oakwood Heritage Hospital, which has what we call a hyperbaric treatment center. Is that correct?
Yes, it is.
Great. Well, thank you so much for being with us. And I'd like to start off right off the bat and ask, why do diabetics have foot problems?
The simple one-word answer is the word neuropathy. They develop neuropathy, which is a lessening of the ability of the nerves of the body to function and work. There's two main types of neuropathy. One is autonomic, which are the nerves that work automatically without any conscious sensation. Those control muscle and foot structure. So when patients develop autonomic neuropathy, they get weakness to their muscle, which causes structural changes such as hammer toes, claw toes. And these are important because it creates pressure points. Also, autonomic neuropathy results in dry skin, which makes the skin less able to hold up against friction and torsion and different pressures against it. Along with that, you also get what people are more familiar with is the sensory neuropathy, or the numbness associated with diabetes. So if you have sensory neuropathy, you don't feel that you're getting pressure points, and a lot of times that leads to the ulcerations and sores, which can be so detrimental in diabetic patients, especially in the feet.
And you brought a photo to show us, because oftentimes injuries or wounds do show up on the feet. What's going on here?
Here you have development of an ulcer, and that's an erosion of the skin. Patients often think of them as sores, and it's important to note over here this is over a bunion or a prominent point. Often it's caused from shoe gear pressure that a patient who doesn't have neuropathy would feel that shoe pinching. But in this case with neuropathy, you don't feel that your sore is rubbing and creating a pressure spot. Very similar, a spot back here could be caused by the back of the shoe rubbing and creating a sore. This can erode down to the layers of skin and even get as far down as the bone.
Oh, so I get it. So I might feel friction that gives me a blister, but a diabetic patient doesn't really feel the pain as sensitively, so it continues, and that's because they don't have the same sensitivity in their feet.
Right, they will continue wearing the same shoe until it develops a blister and a sore and create a problem.
And how do you treat diabetic foot problems?
The main way to treat diabetic foot problems is to prevention, to make sure that you have proper shoe gear so that you're not developing these ulcerations. If you develop structural problems, those can actually be treated surgically so that those bony prominence and pressure areas are reduced so that they're not creating a pressure point or area to occur. Once the development of an ulcer occurs, there are many new ways that we treat ulcers nowadays. It's very important to offload or take the pressure off the ulcer. The field of wound healing has just really started to explode with a lot of research now down to the cellular level as what's really happening at that wound. And it's guiding a lot of our wound care treatments. Some of them are very old in time, such as uses of silver to help with antibacterial properties. One of the new medications we've been using is actually a medical honey, which they used to use in olden days, but has now been refined and brought up to modern terms.
Is it real honey?
It's real honey.
Huh.
But it is also combined with other properties such as collagens and alginates, which are things that your body uses to heal in the property of skin. So the antibacterial properties of the honey and the collagen help to create wound healing. We're also doing a lot with grafting procedures now. Artificially grown skin grafts, as opposed in the past they actually had to take the graft from the patient, which created very painful areas, but now we have multiple artificial skin grafts that can be done.
So if a patient has a wound on their foot, is that could that be the first sign that they might have diabetes?
Oftentimes it can be the first sign that they have diabetes. A lot of times they have the numbness but don't understand what it is or where it's from, and so patients might develop an ulcer and show up in our office and they don't realize that they have diabetes.
How often should they come to see a podiatrist? Should they come to see you even before they see a wound develop on their foot?
Yes, the best time to come is at the first diagnosis of diabetes, if you know you have that diagnosis, because then we can teach you ways of prevention. We can also identify any pre-existing factors, such as the structural deformities that might predispose you to develop an ulceration. And it's very important because then you also develop a relationship with your physician. So if you do have any adverse effects, such as an ulceration, or you're comfortable with that physician, you've developed a relationship so you can work together as a team to treat and heal your ulcer.
Now, you've mentioned the team of physicians that help a person with diabetes. How do you as a podiatrist coordinate your care with the other physicians involved in a patient's overall treatment?
We work very closely with the patient's primary care physician and endocrinologist a lot of times to make sure that their sugars are under control. In our office, a lot of times the referral is generated from their primary care physician to us. Any notes, any information that is gained at the visit from our office is automatically sent to that primary care physician, and oftentimes there are other physicians as well, anybody else that's working in their care, whether it be an infectious disease specialist or their vascular physician. Also with Oakwood, they have such a great electronic medical record system that I have immediate access in my private office to any of the laboratory or diagnostic tests that have already been done by their physician. That allows me to provide more immediate care instead of waiting for another result. It also prevents me from doubly ordering something that's been done before.
What is it about wounds on diabetic patients that make them difficult to heal? And what's the connection to this hyperbaric treatment that you also have expertise in?
The diabetes, the high blood sugars affect and change every system in the body, from affecting the nerves to affecting your vascular system. It also affects the cells in your body and the way they heal together. That's why a person without diabetic can get a sore and they'll heal it quickly, but with diabetes, your body doesn't have the proteins and the enzymes and the factors that work properly together in order to heal that. And then it's compounded by the fact that you can constantly re-injure that area due to the increased pressure that you're not feeling from the neuropathy. Hyperbaric medicine helps because it actually increases the amount of oxygen at the wound in order to allow things to heal.
Ah, and oxygen heals.
Yes.
So if there is a viewer watching today who suspects they might be diabetic or they know they're diabetic, what's the single biggest piece of advice you have for that viewer about foot care?
The most important thing is if you suspect you're diabetic, make sure you follow up with your primary care physician so that they can evaluate and determine if you have diabetes. As far as foot care is concerned, prevention obviously is the key. You want to make sure that any problems you have are identified and are prevented. Once you do have an adverse effect, though, the most important thing is to make sure that you seek treatment. Most of the times when things lead to amputation, it's when patients have let things go thinking it will heal, it will get better. And a lot of times these things cannot improve just on their own.
Well, I want to thank you for being here. You are an Oakwood Healthcare affiliated podiatrist, and you have offices in Taylor. If people want to find out more about you, they can go to oakwood.org, but are you accepting new patients?
Yes.
Great. Great. Well, I sure hope someone who hasn't seen a podiatrist will pick up the phone and give you a call. Thank you so much for being with us today.
Thank you for having me.
We've been talking about foot care for diabetics with Dr. Deborah Woody. In a minute, we're going to talk about eye care for people with diabetes. So stay with us. And if you'd like to learn more about any of the physician experts who you've heard from today, check them out on oakwood.org or call 1-800-543-WELL. We'll be right back.
How you doing? My name's Steve. My family's lived in this neighborhood for years. Recently, things got so tight, we had to go to our local food bank for help. I lost a lot of sleep worrying about what the neighbors might think. That is until I saw them there, too. How'd I do, Steve?
A little stiff. You could have done a little better.
What? Come on. You know, I have an Academy Award.
Yeah, but not for playing me.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
Packers. Viking. Packers. Viking. Viking.
Red state, blue state, vegan.
Carnivore.
We come from different places.
Uptown.
Downtown.
Optimist.
We come to different conclusions.
Half empty.
Half full.
But when we live united, we create real, lasting change in the building blocks of life. The education, income, and health of our communities,
Live
our families,
United.
even the person next to us.
Live united.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.